Okay, good morning everybody. Thank you for joining us here online for GLMI's Expert Webinar Series. The first Expert Webinar Series is going to be Revenue Cycle Management. I'm joined here by Abby Green, the CPA at Jessup Group. Abby is currently the Managing Partner of Jessup Group and leads the nonprofit services and audit divisions of the firm. As part of the healthcare consulting team, Abby provides assistance with accounts receivable management, billing audit compliance services, financial analysis, and benchmarking, business planning, and performance improvement. So thank you very much, Abby, for joining us here today. And the floor is all yours.
You're welcome, Art. Thanks for having me. Good morning, everyone. As Art mentioned, I am a CPA. We have offices in Michigan, but I enjoy working with GLMI clients all over the place. And one of my favorite topics is home care financial management. Glad I get a chance to talk about that this morning. As we look at the schedule this morning, we're going to begin by talking about the revenue cycle, how to define it, and what it is. We're also going to look at what we consider management of the revenue cycle, some different ideas about how you can monitor your performance, ways that you can measure your performance. We're going to talk briefly about some of the most common key indicators in the revenue cycle, and then talk about next steps in our series here. So to start with, I thought we should take a minute and just make sure we all understand, have a common understanding of what the revenue cycle is. It's a pretty common term seen in healthcare specifically, and it refers to all of the steps in identifying, producing, billing, and collecting revenue. This includes the referral process, which is all of the work that's done up until the admission itself, including all the follow-up paperwork, the patient care delivery, the ongoing visits and visit notes, billing, and as well as collections. And if you think about your agency, this is a pretty complex cycle. And one of the things that we hope to do is give you some ideas on how to manage the complexity. When we look at revenue cycle management specifically, we look at the business practice and decision-making processes that affect an agency's ability to collect payment for services. So management of the revenue cycle really talks about what your business practice is and what your processes are related to that. The complexity is, part of that is due to regulations. And then when you involve the continual cuts in reimbursement, your ability to manage that complexity is what is going to give you the business edge to survive. So now that we know what it means, let's talk about the outcomes of effectively managing the revenue cycle. If you are effectively managing the revenue execution, these are some of the things that you should experience. First of all, you should be able to reduce some of your costs. That includes the cost of wasted efforts, which could include too much travel time, too many manual processes, lack of communication between the different departments, which creates a lot of extra back and forth. It also will include reduction of rework. And when we talk about rework, think of things like the time it takes you to correct plans of care, how many times you have to resend a canceled wrap, how many times you need to rebill a rejected claim. All of those acts of rework cost money, and anytime you can reduce those, you're going to save costs. Also, any time that you can reduce delays, the time it takes to collect the bill, you're going to save costs. First of all, if there's a reason in your organization that you have excessive quality review of charts that slows down billing, it takes longer to get the bill collected, If you have excessive time delay waiting for physician signatures, it takes longer to send the bill out. And as you have more and more time delay, you may experience cash flow issues that require you to go out and get financing to operate your business while you're waiting to secure those claims. So that financing cost is also something that you can avoid or reduce as your processes are more efficient. On the other side of the coin, not only can you reduce costs, but you can optimize your income. When you think about how many approvals on your managed care claims, if your process for renewing those and for securing the initial prior approval isn't working right, then you're losing income. Likewise, if you have visits that are made but not documented, then they can't be billed and you've lost some income there. When you look at OASIS coding and the ability to maximize your reimbursement through your coding process, a more standardized approach may allow you to optimize income. There are things like contract negotiations with your managed care rates. I know sometimes we can't affect that, but when we can, that's something that will optimize income if you have a standardized approach to your contract negotiations. And finally, if your revenue cycle is being managed properly, you will most likely reduce your risk of a post-payment audit adjustment due to inadequate claim documentation, increase in your overall profitability. So about right now, you may be asking yourself some of these questions. Are all of the revenue cycle processes in my agency operating at peak performance? Where should I focus my improvement efforts? Where should I start? How do I know? Is my measurement data accurate and timely? These are all really good questions. And so we're going to start going down that list and answering some of them. The first step to answer those questions is to pick which performance indicators you want to measure, because you do need to measure your performance. You want to look for measurements that can be trended and compared, that are objective, and that you can calculate using your own data. And you want to look at least one measure for each cycle that we reviewed earlier. Some of the factors that will influence your choice of a measurement may include how easy it is to secure the data, whether you have benchmarks available to compare yourself against, and whether the benchmark is required by regulation. It may be difficult to get some of the measurement data that you need, but if you have a performance indicator that you want to measure and it's important to you, think about ways that you can get that data either to measure less often but still measure quarterly or yearly, for instance, instead of monthly, if it's difficult to calculate the data, or to dedicate the man hours to collect the data manually. Often the reason agencies are not able to calculate a measurement is because they have a manual process that's outside of their computer system, so they have to manually tally indicators. If you do that once and you decide it's worth the effort, then you may decide to find a way to automate the system so that data isn't manual any longer. And we'll look at some of this a little closer in a future session. So once you know which indicators you want to measure, you want to develop a measurement tool. And you may want, depending on the indicator, you may want to look at your measurements weekly or monthly. They may be part of your monthly financial statement. They may be a graph or tables or percentages depending on your audience. Some people like pictures, some people like numbers. And it also may depend on how much time you have, the reader has available to analyze the data. So on the next two slides, we have some of the possible key indicators. And we're just going to go briefly through those just to get you thinking about them. And we'll go over these more closely at a future session on exactly how to calculate and what are the components of each of these. Under the referral process, most people look at the number of referrals. That's usually a pretty easy statistic to get. And also, you should be looking at your conversion rate. There are quite a few indicators under each of these. I've only listed a couple just to get you started thinking. Under admissions, turnaround time for paperwork, how long it takes the nurses to turn in their paperwork, and how much time it takes to lock and submit the OASIS. Under patient care delivery, look at your physician signatures, how many are signed and returned timely, or what percentage, or what your average time is that it takes to get a physician signature signed. Also, percentage of field staff documentation completed timely. Under billing, some of the most common indicators are how many days it takes to wrap a claim, an episode, or how many days it takes to final bill an episode. You also probably want to occasionally figure out what percentage of your claims are being rebilled. Under collections, one of the most common indicators is how to bill accounts receivable, what your billed accounts receivable aging is by insurance. And also, you should occasionally be looking at what your percentage of write-offs are by reason. What are the reasons for the write-offs, and what percentage of your dollars are being written off? And then there are some common just general management reports that we often measure: total earned revenue, the number of certifications and recertifications, the average revenue per episode, and the average visits per episode. So those are just some of the key indicators, and we're going to go back to the previous slide. So right now we have talked about picking your performance indicators and developing a measurement tool, and we've looked at some of the most common indicators. What I want to talk about next is how important it is to make sure your month-end close process is providing you with complete and accurate data to measure. And remember, the goal of a month-end close process is to know with some certainty what the earned revenue was for the month. I just want to talk a little bit about earned revenue and remind everyone that the entire home care team is part of that process, whether they know it or not. The timing of the submission of the field staff notes is just as important as the final step in submitting an electronic batch of bills, and one cannot happen without the other. And if that information is missing when the month end is closed, then the incomplete benchmarks could lead you to wrong conclusions. So you want to be sure that your month-end process is giving you complete data. Most agencies have a pretty good idea of what their cost data is and how it matches the visits that were made in the period. But we all have, under the episodic revenue, struggled a bit with figuring out how to measure earned revenue in a period. Some of the methods that are used to calculate earned revenue are booking wrap and final amounts when billed. And the problem with booking your wrap and your final amounts when they're billed is that you could have really wild fluctuations in your revenue stream depending on what your billing patterns are. Some agencies spread the anticipated payments over a 60-day period, but really most episodes are not 60 days long. So if you're spreading your revenue over the entire 60 days, you're really not matching the time period that the revenue is earned in. I have seen some agencies that spread the anticipated payments over their planned visits, and this is a very accurate way to spread visits. It matches the earned revenue to the expense really well, but it's a fairly difficult way to measure, and it probably takes more time and effort. It may not, the additional accuracy may not always be worth the cost. So the method that I prefer and the method that GLMI uses in their month-end process is to spread the anticipated payments over the agency's average episode length. It's accurate, it's easy to measure, and the only caution is that you need to recheck your average episode length from time to time and make sure that you're really using your own agency's average. So that's just a brief overview of what I think of when I talk about month-end close process related to revenue cycle management. And we're going to go over the actual steps of that process in a future session. So once you have your month end and your tools, your KPIs all measured, you want to be sure and publish it. And the only thing that I want to mention about publishing reports is that we're all very busy. We're all caught up from time to time in the day-to-day urgency of doing our business, and it's sometimes difficult to allocate adequate time to this step, to actually plan and measure and publish reports. And just take a few minutes and make sure that you have thought about the urgent issues taking up your day compared to the important tasks. Some of the most important management functions are seldom urgent, and this is one of them, I believe. But over time, the lack of monitoring and analyzing your data and forming a thoughtful response will negatively impact your business success. So be sure and carve time out for you and for your team to compare and validate your metrics, develop conclusions about the performance, and take action steps to respond. Consistency will yield results, and if you are looking for a goal to set for yourself, just take one action step, draw one conclusion from each month's report, and just take one action step, agree on it as a team, set some responsibility goals and some timelines, and just try to do one small action at a time. If you do that consistently, you'll be surprised at the results that you get. So what are some things that your key performance indicators may lead you to do? If you look at some of the possible action steps, I just wanted to go through a couple examples. Time? All right, says we have time. That showed you what percentage of your contractual allowance was for each commercial insurance payer. And you notice that that percentage of contractual allowance was increasing, trending up over the last 3 or 4 times that you measured that indicator. So the first thing that you would do is go back to your referral process and look at your insurance verification process and make sure that was working. One of the things you may find is that your prior approval or reapproval process broke down, and you have a backlog of prior approvals that just either are not billable or are waiting for someone to follow up on. So that is an example of how your contractual allowance percentage key indicator can help you problem solve. In that case, you would want to get some help eliminating that backlog, change the process so that you're watching it more closely and get back on track. Another key indicator you might notice, if your days to wrap are trending up, if you notice over time that it's taking longer and longer to get the wrap bill out the door, you may want to go back to your clinical process for coding the OASIS and finalizing admissions, and look to see if you have some new staff perhaps that's not through their orientation process or missing staff. You may have taken a step to increase the number of charts that you're reviewing, and that's slowing down billing. Those are some of the causes of having days of wrap increase. So to solve that, you might turn to some assistance with quality assurance, getting some expert coders in to do some training to affect your OASIS, or get some mentors assigned to your new staff so that you're able to discontinue that 100% quality review of their chart, and also get some help in get your billing caught up. So you can see there are several different indicators that then you take back to the process that they affect, and through some teamwork with your staff, you can figure out what's causing the delay and then watch that key indicator as it improves over time. So in summary, we've talked about how important it is to have accurate data for good performance measurement. We've talked about the month-end close and how critical that is to get the accurate data into your system. And just remember that business success depends as much as on the first step of the revenue cycle as it does on the final step. And consistency is important. And thank you for joining us today. I think we have time for a few questions. I just wanted to go share with you a little bit about some of the slides. Our agency is a public accounting firm, and we have a full range of public accounting services, including internal control audits and oversight, financial statements audits. Cost report season is here. We can help you with your cost reports if you need that help. We also have an expert tax team that does tax planning for individuals and small businesses and corporations, and also for nonprofits. And thank you, Art, for inviting me to join you today.
All right, thank you, Abby. And just a reminder, the expert webinar series continues next month and the following month after that. So February 21st, 11 a.m. Eastern Time, Abby's going to be talking about the month-end closing process. She described it. We're going to dive a little deeper into that. And on March 20th, Abby's going to go through the cost reporting process. So please register for those. Go out to the glmi.com, click on the training tab, and there's the calendar out there for you to register. And as always, those are free. And thanks to our sponsor, which is the Revenue Cycle Management team. A couple of these questions we asked last month, and it's falling behind your collections. As Abby said, it's very important that you get a handle on your collections process as a piece of that revenue cycle management. So if you have questions, and I think the first step is to give us a call. We'll actually do a free billing and a financial audit snapshot, kind of give you an overview of hopefully answering some questions that you may have. I guess a question I have for you, Abby, is out of some of the key metrics or the KPIs that you had mentioned, how many can you get all of those through GLMI, or does it really depend upon what you want to measure and how you're going to measure it?
Good question. Most of those key indicators, you can get most of the data out of GLMI. There are a few key indicators that we have to dig for more than we'd like to, and we're going to help you figure out which ones those are and make it easier. Some of the key indicators, depending what they are not in the GLMI system. I know some of those referral indicators may not be measured. Sometimes it is helpful once you have the key indicator identified to go back and review how you're using the system, because there are some things that GLMI can measure and track, but if the user hasn't set it up that way, then they would need to do a little modification.
Great. Thank you, Abby. Abby's contact information is on this screen here. The website is jessup-group.com, and Abby's email is abbyg@jessup-group.com. Go ahead and feel free to shoot her off some questions if you have questions regarding the revenue cycle management process. And as always, our contact information is below if you have support questions or sales questions. All right, it looks like we were very thorough today because there's no questions today, Abby, other than the one that I just had.
Thank you.
And I want to thank you again thank you everybody for joining us here online. This will be published on YouTube later this afternoon if you wanted to, if you came in a little late and want to hear the beginning. Also, if you want to share with a couple key people at your organization. So again, the GLMI videos is the YouTube link. And feel free to go out there and click on that video later today. And again, thank you very much, Abby, for your expertise today, and we look forward to next month's session.
Thank you, and appreciate everyone listening.